We had a vote yesterday, which was, to say it was overwhelming is probably an understatement, for the Veterans Access to Care through Choice, Accountability, and Transparency Act. That act will create more accountability in the VA health system. It will result in the hiring of more doctors and nurses and provide resources for veterans and their spouses to attain a quality education. So we're grateful that that happened. We're grateful for the overwhelming vote. And we're certainly optimistic about the results that will flow from that legislation. We have more to do in addition to that. We need to continue to look for ways to address the claims backlog that my colleague from Nevada just outlined, as well as other issues that will come before us. I want to thank the chairman of the Veterans Affairs Committee, Chairman Sanders, who is with us today on the floor, and the Committee on Veterans Affairs for their work on behalf of veterans. The claims backlog that my colleague just talked about is a critically important issue for veterans and their families in Pennsylvania, in Nevada, and I know all the other states as well. And I want to commend the work of Senator Heller and his staff. My staff worked very hard on these issues. I want to commend especially Jillian Mueller, in addition to John Richter, for their work on the issue itself, the working group work, collaboration, I should say, that resulted in this report that Senator Heller cited. This is a substantial report on a very difficult problem. Here's what the problem is. The problem that the working group addressed, but also our legislation addressed, that I'll talk about in a moment. Here's the problem in terms of days. The backlog is especially high across the country. The average backlog in days is 241 days. Unfortunately, in Pennsylvania, it's even longer. About half of our state and the western part of our state, 316 days, 294 days in Philadelphia in the eastern part of our state. So to have a veteran and his or her family wait that long for the processing of claims is, in a word, unacceptable and should be addressed. And that's why we introduced the 21st Century Veterans Benefits Delivery Act, which was developed from the findings of the working group and the report that was produced. This is a common sense approach, a bill that focuses on three areas that will ensure a faster and more accurate delivery system. The bill will help ensure that veterans, the VA, Congress, and all levels of government are working together to bring down the backlog and get veterans the benefits they deserve in a timely manner. It does basically three things. First, update the claims submission process. Two, improve the VA regional office practices. And three, demand more from other federal agencies. This backlog problem is a VA problem, but it's also a problem of other agencies not doing their job to help the VA. As Senator Heller noted, we had great support in the working group, as well as 17 bipartisan co-sponsors of the 21st Century Veterans Benefits Delivery Act. And I would respectfully ask Chairman Sanders to help us schedule a hearing on the legislation, and we're grateful for his willingness not only to work with us, but to help advance this very important legislation. Madam President, let me conclude with one thought. I've often said that one of the obligations of every member of Congress is to prove ourselves worthy of the valor of our veterans, to make sure that we're keeping the promise to our veterans. You can't just prove yourself worthy of their valor by thanking them for their service or patting them on the back or going to public ceremonies. We've got to act as we did yesterday. The next thing we should act upon is the claims backlog, so that we can truly say that we are worthy of the valor of our veterans and keep the promise to them, to their families, and to our country. And with that, Madam President, I would yield the floor.